Today in round I was teaching about C. difficile colitis. One of our patients had developed C. difficile colitis after use of piperacillin tazobactam. So I was teaching about this condition to a group of medical students, and one of the students asked me that C. difficile is a normal bacterial flora of the colon, right? If you check my colon or yours colon, there may be C. difficile, but it is not causing colitis in your colon or my colon. It is just living there, right? So why it is not causing colitis in us? Because there are zillions of bacteria inside our colon apart from C. difficile, like Bacteroides fragilis, Streptococcus, Enterococcus, tons of many bacteria are there. And in that environment of the colon, C. difficile is not able to produce toxins. There are two types of toxins this bacteria produce to manifest as colitis. So in this environment where there are tons of other bacteria, this C. difficile is not able to produce its toxins, and thus we do not get colitis. But when you consume some antibiotics, either cephalosporins, beta-lactams, or macrolides, fluoroquinolones, any group of antibiotics, these antibiotics not only kills infectious bacteria but also kills our colon bacteria. And when these bacteria are killed, but C. difficile is not affected by that antibiotic, so C. difficile remains there and other bacteria are killed. So C. difficile gets chance to proliferate because other bacterial populations are less, right? So it proliferates and starts producing toxin, and thus it can cause colitis. But that many people take antibiotic, but not everyone develop colitis. You might also have taken many antibiotics, either oral, IV, but you might not have experienced colitis, right? Because this bacterial population inside the colon is very in large number, enormous number, and even if you kill with this low dose of antibiotics, those again repopulate, right? So you may not manifest colitis, but this is also linked to immune system, right? If whether the immune system of the person is optimum or not, right? So it is not just bacterial influence but bacterial interaction with the immune system of the body. This immune system of human body or any living creatures is very complex to understand. If you see my colon, there might be many protozoa, Giardia, amoeba, maybe, but I am not manifesting those symptoms of amoebiasis or giardiasis. It may be present, right? Because my immune system is able to contain it and it is not letting it invade inside my system, right? But when this immune system gets weakened, either with exogenous drugs intake or any disease inside the body, then this protozoa, amoeba, whatever the bacteria, this starts to manifest in symptoms in the form of inflammation, right?